CyberKnife, and a lot of folks think that it's a knife, it's actually a radiation treatment unit, and the key to the equipment is it doesn't need a knife. We're able to treat a tumor directly with a radiation beam and kill the cancer just as if a surgeon were to cut that cancer out.
This like puts everything else to shame, right?
It's really the only technology like it in cancer therapy today. It is able to accurately target a tumor from 200 different directions. This is an example of a lung cancer patient that we have on treatment that depicts the beams of the CyberKnife coming in on the tumor in the middle of their chest. The more beams that we're able to treat with radiation, the less damage we cause to the normal organs in the body. So we're able to achieve extremely high radiation dosages to actually kill that cancer with a better than 95% success rate in our data right now.
How was it done before CyberKnife?
Typically, patients would go to the surgeon, and a surgeon would operate and remove that portion of the lung. But the patients that we see for CyberKnife aren't even candidates for surgery. Their lung function or their emphysema or COPD is so bad that they're not really good operative candidates. So rather than go home, we're able to offer these people actually a chance at cure of their early stage lung cancer with this technology.
Is this the biggest thing you've seen happen in this treatment field?
This is the only technology that I've seen in our field that we've been able to deliver curative doses of treatment with almost no side effects and extremely few complications in a majority of patients. The other nice part of this technology, not only can we come in from 200 different directions, it's completely non-invasive. We don't have risk of infection. We don't have risk of a lung collapse from having to put a needle in the lung. It's an extremely unique technology. One of the other things about the technology is really our software. It can see the tumor in the middle of the body, and the robot actually is able to track the tumor and breathe with the patient as it's delivering the treatment. So it's not treating the normal organs around the tumor. It's directing right on the tumor. We're very fortunate here in Erlanger. We were the first site in the world to have this tumor tracking software that allows us to target the tumor and be able to track the tumor so accurately that it reduces complications to the surrounding normal lung. So if this is a tumor in the human body right here, the red spot, then basically this is the radiation dose that we're delivering around it. It is an extremely tight dose, and as it moves away from the tumor, the dose falls off very rapidly. So neither the heart nor the normal lung or the other tissues are getting any of the radiation, or at least a minimal amount, that all of it is concentrated right on the target from all these multiple beams.
I'm amazed at what CyberKnife can do. It's not a surgery. There's no knives, no cutting, no poking, no prodding involved, and the patients basically have little to no side effects.
Patient Navigator, what is that?
Patient Navigator is a consistent face for cancer patients throughout their journey, from pre-diagnosis to diagnosis through treatment process.
What's been one of the best things about what you do?
One of the best things is being able to be that go-to person or that consistent face for the patient, making them smile or alleviating some of their anxiety while they're going through one of the most difficult times in their life.
Take us through what you do. I come in as a patient.
One of the doctors would give me a call. I would come in to talk to you and just find out what your needs are. Everybody's needs are different. Most of the time when I see a patient, they're going to have a bronchoscopy. So we talk about what a bronchoscopy is and about getting a biopsy and how long the biopsy takes to get results. And then I come and go to the procedure area with you and see you before procedure and then after too. If there is a diagnosis of cancer, then I'm that support person and I'm that go-to person that they can call when they're scared or when they need more information.
CyberKnife. Well, that's something else over there. For more information, 423-778-LINK.